Hi, this is Dr. Raj. I'm your friendly Beverly Hills surgeon who treats joint pains and sports injuries. I'm here to keep you out of the operating room. Now, we were talking about how obesity in itself perpetuates all of these small little dinky companies that make these medications, Fen, Xantrex, which leads on to death. Obesity can kill you indirectly. Here's the problem. I mean, everyone's looking for a quick fix when the real fix is hard work. Hard work entails what? Exercise and eating well. The question is, are we really that lazy of a society? I hope not. I mean, if it's for your health, why would you even think about taking a pill that invariably affects your metabolism, increases, is a stimulant, and you're compromised as it is. When you are overweight, you've got medical issues, you got impending issues, and you put yourself at risk. I know myself. I mean, I tell you, 10 years ago, I went through a phase where I had a little more weight than I want, and I've always been athletic. And I was busy at work. I was trying to keep myself going, ADHD, trying to keep myself busy. I started eating more, eating late at night, enjoying processed food and enjoying sugars or anything that would give me comfort. And what happened is, what that resulted in is, during my early 30s, my hormones were down, and in my 20s I could vaporize a pizza just because of my metabolism, but all of our bodies change as we get older. And instead of vaporizing, I started expanding. And I looked for comfort with stress. I dealt with stress with food. And I would eat more and more and more. And it came to a point where I realized I was heavier than I wasn't I wasn't obese, but I was overweight. I mean, my BMI was probably about 20.
How much
29.
weight did you gain? Like 15 pounds, we're talking? 20, 30?
Well, probably about 20 pounds. It was about 225, which is big to me. I mean, at my leanest, I'm about 200. But that extra 25 pounds, I started having joint pain, and I tell you, I felt horrible. And the only thing that actually alleviated my feelings were just food. I mean, and for me, it was processed food, like, burgers from fast food joints, Kentucky Fried Chicken, French fries, chips, and I realized where I was going. I didn't feel good in my clothes. I felt low. I felt lethargic. But you know what? I made one big mistake. Instead of looking for that quick fix, I got addicted to a medication called Xantrex. And it's on the market.
No, you didn't. Are you serious?
Yeah, I was Mr. Blue Pill.
Oh, wow.
I said it's over the counter, and it gave me, the stimulant effect. It increased my energy, because when you have extra weight, you are slower. You are more lethargic.
Did it decrease your appetite? Did it decrease your appetite?
It decreased my appetite and gave me a stimulant effect. It actually also made me, in retrospect, it made me sick. But what it did, Jani, is at that point, it controlled the point. I didn't want to gain more weight, and I didn't gain more weight. I lost a few pounds. But I realized after about a year of taking this, and I realized it's all hard work, and it knock on wood.
But do you recommend somebody taking that in transition? I mean, I would think no.
No, absolutely not. I recommend, there's side effects with everything, and it may catch up to you now or it may catch up to you later on, but in the end of the day, you'll remember that day when you have a certain issue 20 years down the road, and they say that all people who took Xantrex are prone to this now. So remember that.
So what were the side effects of that with that drug?
Right now, I'm not sure. Right now we're not sure, but they talked about it. It's a stimulant. So you don't know what the long-term effects of this are on your liver or your pancreas. I mean,
right.
That's a 20-year-plus effect. And what I'm saying is I felt gross on it in the sense that I felt like I needed it in order to function and feel okay. So,
but it's basically using one addiction to substitute another addiction. We are an addictive society, and that's what needs to change. We are covering up because we don't want to deal. I know, but we don't want to deal with the real issues. We don't want to deal with our pain. We don't
want to do hard work.
We don't want to do hard work. The hard work is actually looking at the scary stuff in our lives and admitting to ourselves what we don't want to admit ourselves to. It's called consciousness.
Yeah, it drives me nuts. I mean, I look at it every day, and on a conscious level, now I realize being in shape or taking care of your body is hard work. But the price you pay is you feel good. That's the result is you feel good. And you feel great all the time. So I would trade that off at any day. I mean, we had a great show today talking about obesity and talking about how joints are loaded quicker and how replacements are being done earlier because of obesity. And also off the topic about C.J. Spiller and his poor crazy injury that knocked him out for the season on his collarbone. The underlying message is, with this whole obesity epidemic, is take a step back, look at yourself, realize that, this is not going to be a quick pill or a quick fix. You need to do hard work. It's not going to happen right away. Exercise, eat right, act like a caveman. I was watching The Walking Dead yesterday, and their caveman guy was eating people. I don't recommend, of course. But
don't eat people. I'm a vegetarian. You can eat live, leafy, green things that feel good.
So you know what? At the show, they said, we're having a barbecue. Bob was the person they were barbecuing. But you know what? I thought, all in all, I want you to take care of yourself. Jenny and I want you to do hard work and don't be a victim of your weight. You have time now. No age. There's no excuse now. You don't need a pill. You don't need a surgery. Take care of it. So thank you for listening to our show today, and I look forward to talking to you with our new exciting topics next week. Thank you, Jenny.
The opinions you hear on Lifestyle Talk Radio are those of the hosts, callers, and guests, and do not necessarily reflect those of this station, Lifestyle Talk Radio, its management, or advertisers. The information on Lifestyle Talk Radio does not constitute a recommendation, offer, or solicitation to buy or sell any product or service. If you have any questions about Lifestyle Talk Radio, contact us at 817-274-1609 or at lifestyletalkradio.com.